Current cancers anywhere in the body. Gil Lederman's the guy to go to. He's a brain and prostate cancer as well as body cancer expert, also treating breast, lung, pancreas, liver, kidney cancers, and more. So, to hit the cancer, you call 212-CHOICES and set up an appointment with Dr. Gil Lederman, 212-CHOICES. Or do it for someone that you know won't do it for themselves. He'll send you an informative booklet, DVD in advance, and then you cop a squat with him at his offices at 38th and Broadway. Dr. Gil Lederman takes most insurances, Medicare, and Medicaid. Just call Dr. Gil Lederman for your cancer treatment choices at 212-CHOICES, 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back. It's Dr. Lederman from Radiosurgery New York. We're here talking about cancer news, health news, and patients. We have Ernie on the line from Rhode Island who wants to speak to us. So, good morning.
Good morning, Dr. Lederman. In the case, if you were to find a mass, say, in the bladder, is there an advantage of proceeding with radiosurgery without a biopsy?
Well, you want to get a biopsy, and the biopsy is so important. Why? Because, number one, it's the proof of what you have. Mm-hmm. That's to say, if we treat you and it goes away, everyone will say, it probably was nothing. Mm-hmm. So that's number one, to avoid skepticism, to know what you have. Probably your insurance won't pay for any tests or treatment if you don't have a biopsy. The first thing they ask when we call them is, was there a biopsy? Because they don't want to spend thousands of dollars on scans and treatments and tests and things if you don't have proof. And so you want to know proof. It's good for you to know, and it's good for you to have that document in your hand. Here's the proof. Look, in 2014, I had bladder cancer. Or in 2014, hopefully you'll be able to give a paper, I didn't have bladder cancer. So really, it's critical for you. You want to know it. And when you start cutting corners in medicine, you end up usually with bad results.
Yes. All right. Thank you very much, Dr. Lederman.
All right. Call us during the week if you want the booklet DVD. We're happy to send it to you.
Yeah, I've already gotten it, and I must tell your listeners it's well worth receiving. It's quite something, and I can't tell you how much I appreciate getting that.
How'd you hear about our program in Rhode Island?
Well, I was just switching stations, and I found your program quite interesting, fascinating, and informative. And I think someday it'll be called the Lederman Cancer Center, and it will rival the best in the world.
Well, we are happy to treat one patient at a time, and we don't have to be the biggest. We have a personal relationship with each patient. It's not a big hospital with 1 million doors and 1 million floors and $1 million budget with the president getting millions of dollars. But we like to be able to spend time with the patients, and the critical key is to be able to spend time with the patient, to review the case, to see the patients ourselves, not a student, not a secretary, not a nurse. Look, everyone is important, and I don't have no problem with nurses, and we have great nurses, and my son's a medical student. But when patients are sick, I think they want to really have answers and to be able to talk with a back and forth experienced person. And that's what makes it so different than other places.
Yes, I understand that. You are unique because of the fact that you are in private practice and you don't have to account to administrators, as you said before. It's my father, who had been a doctor at a hospital, was always gumming up the works. So I think you're doing everything just the right way from what I can see. Thank you, Dr. Lee.
All right. God bless you, and come and visit us one day. We're right in the middle of Manhattan.
I will. Thank you, sir.
All right. Bye-bye now. Thanks for that call. And if you have calls, just call us at 1-800-848-9222. There was a new report, actually, in the New York Times this week. About 15 years ago, people were saying if you eat an apple a day and so on, you're going to cut your cancer rates by 30-40%. And now a new report's coming out saying that not is true. So in this article written by George Johnson on April 24th, New York Times, he reported, quote, when the 1997 report came out, it appeared to be a turning point in the war on cancer. Particularly striking was his conclusion: diets containing substantial and varied amounts of vegetables and fruits will prevent 20% or more of cancers. And he went on to say that it's rare to see such an unequivocal statement in a scientific work on nutrition and health. In addition, there was thought to be convincing evidence that the risk of some cancers like mouth, pharynx, esophageal, lung, stomach, colon could be reduced by diets heavy with produce. We'll take this call to see what they have to say here. We're live. Good morning. It's Dr. Lederman. You're on the air, WABC.
Hello?
Hello. Good morning. You're on the radio. This is Dr. Lederman.
I'm calling about the information for the book.
Okay, just call us during the business hours. Right now you're on the radio with 50,000 people listening. So just call us back later, and we'll get your address and name, and we'll send you a booklet and DVD.
You mean in business hours 9 to 5?
Yeah, you could dial 9 to 5, or later today. Call us, and we'll send you a booklet and DVD.
Okay.
Okay?
Thank you.
All right, God bless you. Bye-bye. Okay, and right now we have Kendra from Bermuda. Kendra, I think that was Hugh Hefner's girlfriend, wasn't it?
It could have been.
Yeah, hi.
But that's not. Good morning, Dr. Lederman. My question for you is, I'm calling from Bermuda, and my husband was the one that got me up really early to hear your program. Thank you. I'm calling on behalf of a loved one who was diagnosed in 2012 with stage 2B ovarian cancer.
I'm sorry to hear that.
She had a complete hysterectomy, debulking, and the like. She went on a course of chemotherapy, and a few months passed. The PET scan showed that it had spread to the abdomen area. She's currently going through her second course of chemo, and the tumors showed on the PET scan that there were too many for radiation. So my question to you is now, her recent PET scan showed that the tumors are shrinking and doing well. However, they've insisted that, or they've recommended that she outgo another 2 courses. My question to you would be, would she be a candidate for the radiotherapy now?
Well, it seems to me that, and again, on a case, I really need to see the patient and the documents and the scans, but just let's say everything is as you say. If the treatment's working, I love treatment that's working. And so if she's having a treatment that's shrinking the cancer, I think that's great. And ovarian cancer has a cancer marker, the CA-125, and that should be done, and that should be going down as well.
Yes.
And you should correlate that with a CAT scan, because sometimes the cancer will stop producing that marker. So sometimes the marker is misleading. So if she's getting a CAT scan or PET scan and the marker and everything is getting better, my advice right now would be to stay on that treatment. One thing that we would like to see to evaluate her is the scan, whether it's a CAT scan or better yet a PET scan.
Yes.
We're going to talk later in the hour or one of the other shows this weekend about a case of ovarian cancer. Just came in yesterday to see me. She had 8 debulking surgeries and 6.5 years of chemotherapy.
Oh, God.
And she now has a mass in the lung. She has a mass by the liver. And these are some big masses, 4.5 centimeters. And we actually do treat ovarian cancer, and our success rate where we treat is about 90%. So we're quite effective for certain cases of ovarian cancer. So it's really important to see the patient. Again, she's doing well on treatment, and I always like success, so I believe in success. We would just want to document that and see her scans. And if you call me after the radio show, I'll get your address. If you need the booklet and DVD, we'll send it to you.
Please.
And go from there.
Thank you so much.
All right, God bless you. And I bet you're having a sunny, nice day in Bermuda today.
We are.
Yeah, one of many.
It's in the 70s.
Well, New York's going to be in the 70s, too, so you're missing that sunny day in New York.
But you don't have the beautiful ocean.
We've got a beautiful Atlantic Ocean, and we've got the Empire State Building, and we got New York pizzas and hot dogs and pastrami sandwiches. And
you have Macy's.
We have Macy's and Bloomingdale's and Broadway.
At Barney's.
Yeah, we have all that stuff. And we have me, and if you come here, we have all of us.
All righty.
All right, God bless you, and thank you.
Thank you. Thank you. Bye-bye.
Bye now. So we were talking about diet, and in 1997 when reports came out, doctors and scientists thought that if you eat enough fruits and vegetables, you'll reduce cancer by 20%. So there's a new report, and gone from that new report was the declaration that fruits and vegetables alone would reduce cancer rates. In every case where the evidence before had been convincing, now it's probable, possible, or limited. And the strongest advice now was exercising more and reducing obesity and eating more apples and oranges, meaning fewer candy bars. So trying to get your weight down and in better shape. In 2010, Dr. Willett from Harvard said that this was a disappointing turn of events. The title was, in a report for the National Cancer Institute, Fruits, Vegetables, and Cancer Prevention, Turmoil in the Produce Section. He described the reversion of conclusions, saying that more research, strengthened evidence of fruits and vegetables with risk of cancer is at best weak. And there needs to be a broad effort to consume fruits and vegetables, but that will not reduce cancer incidence. So the primary effort should be on reducing smoking, and we know reducing smoking will reduce cancer deaths by about 30%, reducing obesity. If a 40-year-old stops smoking today, we will know that person will live 9 more years than he would or she would otherwise. 30-year-old stopping smoking today, that person will live an extra 10 years. So stopping smoking will pay huge dividends, and you'll see a great reduction in lung cancers, throat cancers, esophageal cancers, kidney cancers, bladder cancers, and others. So please, if you're a smoker or with a smoker or have smokers in your family or friends, please urge them, stop smoking. We love you. We want you to live longer. We want you to be with us on earth longer. Stop smoking. Please stop smoking. And the next case we want to talk about is a young woman, 46-year-old woman from Iran, moved to Israel and then the United States. She's single, no children. She had a mammogram, and that showed a 1.1 centimeter tumor in her right breast at the 6 o'clock position. She had a biopsy that was positive for infiltrating cancer. She came in this week. She's feeling good, doing well. She couldn't feel the cancer. I certainly did feel the cancer. She wants to save her breast, and we know that data shows that women who have breast cancer and a lump like this can save their breast and can have an excellent cosmetic result. There's no data showing women who have mastectomy do better. In fact, it's the reverse. A couple studies and studies we've spoken about on this show in the last few weeks are that women who have lumpectomy and radiation have a higher success rate than those who have mastectomy. And I know some women think you can remove both breasts and reduce your chances of recurrent cancer. It's not really true. There's a lot of deformity in that. Women who think that a reconstructed breast looks like a normal breast, I think they're wrong. You lose the sensation of the nipple and areolar complex. You lose the normal form of the breast and movement of the breast and texture of the breast. So don't think that just by removing the breast and having reconstruction, you're getting something better. I personally think you're getting something inferior, if you can at all avoid it. So for this woman, she's getting staged up. Going to look at her lymph node with what's called a sentinel node, not cutting out all the lymph nodes because we know that's morbid, and we'll talk about that in a little bit, either on this show or one of our other shows this weekend. So she's 46. She's going to do well. She's got a small